Morning, Volusia County. The other day on Facebook, I asked you to send me questions to ask the experts, and you definitely didn't disappoint us. We got over 750 questions and comments. A lot of them hit on the same issues: testing, closing the beach, stay-at-home order. A lot has happened in the past couple of days to answer those questions, and I really appreciate you taking the time to participate. This panel here has a lot of valuable time, and their time is valuable, I should say, and they're here today to try to get as much information as we can out to our community so that you can make informed decisions about you and your family's health. I think it's important to remember, as you hear these experts talk about different things that are going on in Volusia County, we cannot let panic and fear cancel out common sense. So I'm proud to introduce our panel today. A good friend of ours, Dr. Margaret Crossman, the Chief Medical Officer for Halifax Health. For the Volusia County Sheriff's Office family, Dr. Crossman was one of the first people on the scene when she was off duty, her and her husband, to help out Frank Schofield during his tragic bike accident. On behalf of the Volusia County Sheriff's Office, thank you so much for what you did for Frank and his family that day.
Thank you.
Also, Dr. Joe Smith, Chief Medical Officer at Advent Health. Holly Smith, Communications Manager with the Florida Department of Health. Our County Manager, probably the hardest working person in this room, George Reckenwald. And Dave Otati, the Regional CEO from Advent Health. So thank you for being here. So we're not going to waste any time. We're going to get right into it. County Manager's got a lot to do today. George, the first question comes from Karen Sullivan. Is there a list available of what are considered essential businesses?
Yes. You can find it in several places. You can go to our website and click on, and they'll give you from the governor's orders. But it comes from the Homeland Security. The governor didn't reinvent the wheel. He went with what Homeland Security had put out. He did tie in also, if you want to do even a little bit more internet time that maybe all of you have, he also tied it in with the Miami-Dade ordinances. So you have, if you really want a complete list, you got to look at both of them. But essentially, what that does is it ties into essential activities, and it's a pretty broad range, you know, things like healthcare, public health, law enforcement, food, agriculture, energy, but also things which you wouldn't maybe think, but you would appreciate: water, wastewater, anybody working in critical manufacturing, defense industries, hygiene products, services. So your grocery stores, your drug stores, those type of things, they're all considered essential.
If did you guys post the order online?
Yes, you can go to our website at volusia.org and the emergency management website. So both of them you can get and get a quick look. If you have any other questions, I know a lot of the cities, I talk to the city managers regularly. If you live in a city, many of them are offering the ability to call the city hall, and their attorneys may help you with any kind of questions, especially like if you're a small businessman and you're wanting to know, well, does my business apply? Because a lot of these people really want to do the right thing as well. And also you can do that in the county through calling the County Economic Development Department, which is 1-800-554-3801. And you can talk to them as well if you have any question.
Well, you bring up a good point. If our residents have questions, we opened our CIC center is now open.
That's correct. The CIC is also open here, and I can get you that number probably at the close of this. Okay.
And to follow up on what George said, if you go to Emergency Management's website, if you go to the county's website, or even if you go to the Sheriff's Office website, the order's posted. To save you a lot of time, scroll down to page 24. Page 24 is the Miami-Dade, and what basically tells you what essential businesses are, and then from there you can get a feel of the direction that you're going to go.
That's right.
The next question, boat ramps.
Boat ramps will remain open, but we are watching these things. And again, if people do not follow social distancing, we have the ability to watch those ramps, and we will enforce social distancing.
Dave?
Yeah, Sheriff, I think that's an incredibly important part here that you're bringing up. I know sometimes some people will think that's a decision that's unpopular. Other folks think it should have happened a while ago. When you take a look at a recent New York Times study, it will tell you that Volusia has many folks still traveling all the way around. And it's one of the counties that needs to enforce this much harder than anybody else. They named actually Volusia, they named Jacksonville, they named Tampa as 3 areas that are continuing to socialize in a greater capacity, to the point that I think even in Jacksonville recently, the sheriff had to break up some things as well that were happening, block parties. I think it's incredibly important that we go out and make sure we enforce this because all the models that we have seen will continue to increase the amount of folks infected in this community, and we just really need to hamper down on that component.
Well, Dave, you bring up a great point, and I know the manager's got to run, but what are we looking at? I mean, people look and say, yeah, the numbers are going up, but, it's only 2 deaths. I mean, it's 2 lives, and you're only saying it's only 2 deaths. If we fail to do the right thing at this stage of the game, what could we potentially be looking at?
You could potentially be looking at, according to the CDC models and what Dr. Fauci puts out, somewhere in the neighborhood of nationally 100,000 to 200,000 deaths. When you break that down on a county-by-county level, if we don't put these measures in place, you're talking 2 to 5 people per day per county. Those are lives that we can save, Sheriff, by continuing to exercise good hand hygiene, social distancing, following the guidelines of the CDC, your primary care physician, and the healthcare professionals in your community. It's going to be up to us, Sheriff, to determine how bad this is going to hit us. And the closer we adhere to those recommendations and those guidelines, the safer we all are, and the more we can push those numbers down towards 0.
Dave, I thank you so much for bringing that up because I've gotten a few emails about, hey, I live in a gated community, and this weekend our pool's closed, but we're going to have a block party. But we'll practice social distancing of about 300 of us in a parking lot. And I got to tell you, folks, you got to be a real knucklehead to want to do that after what you're listening to what the medical professionals are saying.
The gate won't stop a virus.
The gate, that's perfect. That's what I tell people about a badge and gun. They say, well, your deputies are different. No, we're not. We can't wave our badge and gun at the virus and say, don't infect us.
That's right.
Yeah, I truly appreciate that. I think we're going to have to clamp down harder and harder, in my opinion. I think you look at every single one of the models, all of the models have us ramping up. I don't have any one of them that has us ramping down anytime soon. And most of them having us hitting a peak in early May. So it's not the next week or 2 weeks. It's May before we start hitting peaks. And hopefully that's, there's always some variation in different models, but so far all the models are showing that. And it could be wrong, but you want to make sure that you follow the best judgments that are out there. And I think we need to really take this and enforce this across the board. It's not just a matter of 6 feet distance and so forth, but what you touch, where you go, everything from the gas station to your clothes going into the house to every aspect of this that we're going to have to really look at. I mean, it just, sometimes I walk in and I'm uncomfortable in certain areas in today's environment. It's not my nature to be uncomfortable, but in today's environment, we're hampering down all of our hospitals, all of our teams in this and clamping down pretty tight today. And we would advocate that across the community.
George, I know you got to get moving. Real quick, this question is from Brittany Seitz. Will Volusia be receiving rent mortgage leniency like in other counties?
Yes, we're going to have a couple of programs that are available. These programs include Volusia County Community Assistance Division, where people who have been impacted by the coronavirus through loss of employment, that we're able to provide up to $2,000 in rent and utility assistance to qualified individuals. We're also using what we commonly call SHIP funds, the State Housing Initiatives Partnership Program. These funds will be available in certain areas of the county. The cities, some of the cities use their own SHIP funds. So I think for people, the best advice is to call our Community Assistance Division at 386-239-7757. And again, we'll do the best we can to help, and I'm sure there'll be other programs forthcoming.
Part of her second question is, and I guess this would go to the health department as well, will grocery stores be limited to 30% capacity? That was something that was passed in Seminole County.
Yeah, and I think Seminole County might be backing off of that. I don't know that for sure, but we have nothing like that planned at this time. I think it's important that I want the message that people will be able to get food, and really the distancing that needs to occur there is use the day, and work as a team, and don't go at the most popular times. Think about it, make some decisions, make a list so that when you go, you're not loitering around, get in and get out. I know some grocery stores have talked about maybe creating a one-way movement through the store. That may be advisable. I know a lot of the grocery stores have already marked off 6-foot increments at the line. Even if they haven't, this is where people need to take a little self-responsibility and take a minute and think. And you can step up close and then realize, oh, I made it, and get back. People sometimes get a little shy. They don't want to say get back. So take that self-responsibility, be extra courteous. I've seen some really nice things that have occurred. I've seen people in the parking lot assisting an elderly person and saying, hey, maybe it's best I go in and do that for you. Acts of kindness like that, I think we need a lot more of to get people through this. But certainly a grocery store, I would use, rather than the 30% occupancy, I would try to space the day, and so that you use the whole day, and therefore you can get in there when it's a little less crowded.
You bring up a great point about looking out for your neighbors, and also the hoarding issue. I mean, come on, folks. If you look at the order that the governor put down, there's really nothing that's closed that affects your life. I mean, essential lifestyle, you don't need to go in and clean toilet paper off the shelves anymore. Take your time, get back to your normal routine as much as you can. Right. Going out and hoarding stuff is it's horrible to be doing that. There's no reason for it.
Yeah, correct. And that's why I think sometimes too is do a little planning. We've got into a lifestyle through the years. I know a lot of people that, we don't plan dinner, you don't plan those things out because we've had that ability to just go and do what we want. A lot of this just means taking a few minutes, thinking about it. And I do encourage those that, to support the local establishments where you can get takeout. Just do it safely. That doesn't mean hang out inside waiting for the takeout. It means get the takeout, order it, and get it, and get out of there. And again, that helps out some of our businesses during this tough time, so you can support them as well. But I would be watching to make sure that they're making and taking the right precautions as well.
This question is for everybody. It comes from Mary Kitchens. Do our city and county healthcare workers have enough supplies? So, Holly, you want to take a gander at first, and we'll ask Dr. Grossman?
Well, the Florida Department of Health works with the hospitals and long-term care facilities on making sure that they have the PPE or the protective equipment that they need to care for their patients and protect themselves. The emergency management here at Volusia County also is assisting other medical-type personnel with that, and George can talk a little bit about the very well-stocked and well-coordinated warehouse that they have.
Yeah, we've used a section of our Ocean Center, Convention Center right now is a point so that suppliers have an easy place to get in and get out of. And we coordinate with all the medical agencies. Again, through emergency management, we're able to put in orders through the state government and make sure that everybody has what we need. So we've been supplying the cities, of course, the county, and we've worked with the hospitals and healthcare facilities on whatever need. And if there is a need out there, again, they can contact us here at Emergency Management, and we'll take care and do the best we can.
They said I couldn't dream. Called me a piece of trash and swore that's all I'd ever be. Said a bottle couldn't see the ocean. Give up. Go back to the dumpster. But I didn't listen. I made my way. And now, I am what I've always wanted to be.
Last night in Walmart, as I was in their shop, and they rolled out a couple cases of Lysol spray. And of course, it was like moths to a flame. And one of the women was yelling, "I need one of those cans. My daughter works in an ER, and they have no disinfectant." And I kind of like looked at her and was wondering, is she saying that to get a can, or is that true?
Yeah, as far as what we're experiencing at Halifax, we have adequate supplies for our needs right now. There are a lot of people who want to use the N95 masks, and some in situations that they really don't need them right at this time, because this is all about the contact and droplet precautions for the most part, eye shields when you're engaging patients who may be under investigation for COVID. It is, as we discussed yesterday, when you're going in for certain procedures that you need that special filter mask, the N95. But in lieu of that, in general, you're typically okay with just the regular masks. So there is currently, when you're trying to balance and keep people from feeling they need to use all their equipment all of the time, their protective equipment all of the time, there's this balance that you run to try to be a good steward of the supplies that you have. So we have come close on a couple of our supplies. The ones that we get a little close on would be our N95s and our shields. I think we've gotten the message out there. There was a little bit of a conflict between what World Health Organization said and CDC advised, and so that's where a lot of the mixed messages were coming from, as well as from the front lines of healthcare facilities that were struggling in the heat of their hot zones. So as we've settled that out among our staff and they understand what they should and should not need, I think we're doing well. But again, N95s, we watch that supply every day. The face shields, masks, we watch that supply every day. We've already started building up our supplies of additional masks. We've got orders out for the masks that we need to have come in, but we do, as I have said, have an army of sewers, seamstresses in the community who are using the pattern that is a UF-based pattern for recreating or creating these N95s or the equivalent of that using a certain type of material. And so we're doing everything we can to plan for, as we talked about earlier, should we see that increase, that spike, and find that all of a sudden we're going through our protective equipment more so, that we'll have opportunities to continue protecting our staff despite increased use that's going to happen that we anticipate.
How about Advent Health, Doctor?
Yeah, at Advent Health, we absolutely have adequate supplies to make sure that our teams and that the patients they're taking care of are safe. I think part of the confusion that has arisen is that we are trying to be very good stewards and not waste that material. And so when we, we're very deliberate about, what we use, where we're following the CDC guidelines about how those assets are deployed. Advent Health has a global purchasing effort in place to bring in supplies to make sure that we're able to meet any surge above and beyond even what the projections are, and we're making sure that nationally we're all cooperating so that our different markets and campuses can share those supplies as needed to respond to surges that may happen asymmetrically throughout the country. But I think the overarching message is, yes, we're being careful with our supplies, and that yes, we have adequate supplies of disinfectants, masks, gowns, all the materials you need to safely care for patients in this environment.
Yeah, I don't think what people understand from our perspective of running an organization is if you put that stuff out in the open shelves, it's gone.
Just like the Lysol.
Exactly. You have to lock it down and make sure, like all of our stuff in the sheriff's office goes through inventory supply. So if a deputy needs a mask, if he or she needs hand sanitizer or whatever, they have to go to inventory supply so we can ration it out. But speaking of supplies, Dave, Dr. Crossman talked about it yesterday, and I really saw it today. People out riding their bikes, people food shopping, people going for a walk wearing masks now. Is that something you guys would recommend?
You want to, go ahead.
I think, I don't think there's a silver bullet, okay? And I think if you live in a congested urban area, probably stay in your house as much as you can. If you live in, more rural Volusia County, there's no reason why you can't be out on your property kind of by yourself, getting some exercise, keeping your spirits up. There's nothing wrong with that. I think that the overarching message is maintain your social distancing, maintain your hand hygiene discipline, not touching your face. as you said, try to cooperate with your neighbors. If you can go shopping for more than one person and do that at an off-peak time, that's fantastic. That's the kind of stuff we need to be doing. I think, the idea of a bunch of people getting into a gym together right now is a really bad idea. But we do want everybody to stay mentally healthy, and part of that is, get a little sunlight, and that might be in your driveway. That's okay too. There are all sorts of exercises you can do without leaving your home.
Right.
Yeah.
And I would add that if we just look at our mask as an additional measure, because we can't leave behind the
Right.
social distancing and all the other things that are so important, the hand sanitizing, the hand washing. And so if the masks create a false sense of security, it's going to work against us. If we handle our mask after touching and coming in contact with surfaces, it's going to work against us. So it's just an additional measure, but we cannot forget those foundational things of watch the surfaces, hand washing, keep some distance. And at a time when coughs, colds, other little reasons, allergies included, are creating runny noses and slight little coughs, it's the right thing to do to cover your cough. So if you're in those public places, having a mask on will help you not leave your droplets, which may or may not be infected, into the environment and create problems on our surfaces that we're concerned about.
Holly? Oh, go ahead, Dave.
I would add to that, too. I appreciate that. I think there's a component of this that a lot of folks say, but I feel well, I'm doing good, I don't have any symptoms. But so far, the research that I've read says that there's at least 25% of the folks that may have it that are asymptomatic. They don't have any symptoms, and yet they're passing it along to others.
Right.
So you got to be cautious that the mask is not just for others, but it's also for yourself, too. And I know, as we continue to evolve here, I think it's becoming a really good idea to just be cautious, watch where you're going, watch what you're touching, and also, and if you're in any type of groups, actually start wearing masks myself. So.
Well, speaking of masks, I guess the big question we constantly get hit with, Holly, is test kits.
Yes.
And Travis or Tracy Culver asks, are test kits available in Volusia County, and if so, where?
I think she's asking, where can I get tested? That's a very common question, and it's not a real quick answer, so I'll try to summarize it for you. So a few weeks back, the Florida Department of Health worked with commercial laboratories to open up testing to increase the availability or the capacity of the system to test people. Prior to that, it was being done by the Department of Health and hospitals for a very specific high-risk group. So now with the commercial labs online, any physician or facility like an urgent care facility can collect samples from a patient who meets CDC criteria and then ship those samples to a commercial lab for testing. So that's the addition to the system. If a provider isn't able to collect the specimens in their office, they can arrange for that to be done either at an urgent care or somewhere. Hospitals also can test, but hospitals are only for people who are really severe with shortness of breath, and I think Dr. Crossman and Dr. Smith will probably talk about that a little bit. The Department of Health does testing, but we are only doing very specific high-risk people. So the CDC, Centers for Disease Control and Prevention, we're throwing that acronym around a lot, has very specific criteria for DOH, for hospitals, and for providers. And the first criteria that has to be met to get tested is symptoms. Someone has to have symptoms. We're hearing a lot of people want to be tested if they're asymptomatic just to know if they've been exposed, and I'm sure we'll get to that question in a little bit of why that's not being done. But right now, if you meet that criteria, meaning you're symptomatic and you're in one of the other criteria that the CDC has set aside, you can go to a provider or an urgent care center to be tested through one of those systems.
To follow up on that, I don't really know a lot of this, but this point of care testing that they're talking about with this new technology that's coming out where you could be tested and in 20 minutes get the results, what do we see? What's the future hold with that?
Sure. So there's a lot of really rapid research happening and a lot of tests coming to the forefront. Not as much validated as they would otherwise have been typically, but this is a pandemic situation, so there's a lot coming to the forefront. We have two tests, and actually several, but the two main ones coming to the forefront are a PCR, polymerase chain reaction test, and that's the one that is best at detecting presence of the virus. In other words, if you are infectious or have the virus in your system. The other one is an immunoassay, and that just tests for have you been exposed to the virus, as evidenced by your immune response is now able to be detected in this study. So the best test for determining if you're infectious will, of course, be the first test, the PCR. And that one is showing pretty good sensitivity. In other words, the ability to pick up the virus if it's there. But if it's the first day or so, if your viral load, in other words, is very low, say under 70 to 100, then it's possible that will be negative and a falsely negative test result. That can happen in the first day or so of having been exposed. We don't know exactly how long that will be, and it's different for different people depending on how rapidly that virus replicates in their system. So there is a window where you can have false negatives. So especially if you're without symptoms, the likelihood of that would be a little greater. But now there is a time to use that and rule out that you have that virus in your system. For instance, if you had an exposure a week or so ago, and you have been quarantined and just making sure that you did not develop symptoms, and now it's time to return to work, and because of the nature of your work, you're in that category where perhaps a negative test would be very helpful. That PCR then could be very helpful in that regard. The other test, the immunoassay that tests to see if you have been exposed, can help, number one, test that, but certainly determine if you are in that window where you have some immune protection. And it's kind of exciting because that's the test that will probably move to the forefront as we're talking about some of the experimental treatments where you can use someone's immune response, their plasma from their body where they have all these immune response and antibodies, and use that to help someone who's struggling with the actual disease. So there's a place for all the tests, but it's all about doing the right test at the right time and not being falsely reassured by having negative tests. The only other place would be for epidemiologic studies, which is something we'd love to do if we could, and we do have some going on. But if we wanted to do a prevalence test and just find out if we test everybody, how much virus can we find in our communities, that will be nice to do at some point in time, and also where we need to focus our isolation or our quarantines, if you will, restrictions of movement for those that may be carrying this virus. So there's a lot out there about testing, but those are the two main ones to keep in mind and keep your eye on.
Dr. Smith, what's the criteria? I mean, I think the big question is people say, well, why can't I get tested, or when should I get tested?
No, that's a great question. So, and let me just take a moment and recognize a lot of us are very visible. First responders, healthcare workers, our Department of Health. There is an army out there of researchers at universities across the planet who are working day and night to increase our capacity to test for this. And they're really kind of unsung heroes in this because they're the ones that are going to arm us with the tools we need. So everybody out there, thank your local university staff and laboratory workers. The reason why we can't test the whole planet, and that's that gets asked, right, is right, this virus was essentially unknown 3 months ago. Right, so there was no test. There's no stock of tests for this that were just sort of sitting out there, ready. So that's been developed and deployed in record time throughout the planet. If you are asymptomatic, you need to do two things. One, you need to continue to follow all those guidelines we were talking about, and you need to assume that either you could infect others or that you could be infected by somebody that's also asymptomatic or who is symptomatic, right? So you're going to nothing changes for you based on the test if you don't have symptoms. If you do have symptoms, you need to call your primary care physician or you need to go to your local Centra Care, and we will evaluate you and apply those CDC criteria to make sure that you're tested in a very timely fashion. We absolutely have enough tests for that, as well as rapid testing available for the acutely sick patients in our hospitals.
Great. That is, I think that hits the nail on the head.
Stay connected with the latest Volusia County news, events, and updates on our social media channels. Like and follow us on Facebook and Twitter. Catch up with previous stories on YouTube, or just head over to our website, volusia.org.